Hi, everybody. Today I've decided to discuss Wilson's disease. It's a rare inherited disorder that causes excessive copper to accumulate in the body. Normally, the liver would get rid of the copper through bile and eliminate it from the body. However, individuals with Wilson's disease are unable to properly remove copper, causing it to build up in tissue and organs over time. If left untreated, this can result to serious organ damage or even death, according to the National Institute of Diabetes and Digestive and Kidney Diseases, 2023. Wilson's disease is caused by mutations in the gene ATP7B gene, which is responsible for transporting excessive copper out of the liver. Because of this genetic defect, copper gradually accumulates and becomes toxic to the cells and tissues uh, from National Organization of Rare Disorder 2024. There's lots of symptoms that come from this, which is the reason why it's rare. And a lot of it goes a little unnoticed because it varies depending on which organs are affected. Early symptoms often include fatigue, weakness, loss of appetite, abdominal pain, and jaundice. As copper continues to accumulate, neurological symptoms such as tremors, difficulty speaking, poor conditions, and also muscle stiffness may develop. Um, some individuals also experience mood changes, anxiety, depression, and/or personality changes, according to the National Institute of Digestive uh, or Diabetes and Digestive and Kidney Disease, 2023. Wilson disease affects several organ systems. The first major organ system affected is the liver. The liver is usually the first organ where copper accumulates, and over time, this can lead to inflammation, scarring of the liver, and even liver failure, according to Cleveland Clinic 2024. Usually, the second organ system affected is the nervous system. Copper deposits in the brain can interfere with normal neurological functions. Patients may experience tremors, difficulty walking, poor conditions, muscle fatigue, and speech problems. Neurological symptoms can significantly affect a person's quality of life if the disease is not diagnosed and treated early enough. The third organ system affected is the visual system. Many patients develop Kaiser-Fisher rings around the cornea of the eye, which are from copper deposits that form. These rings are often visible during specialized eye exams and are important in diagnosing Wilson's disease. Treatment and management focus on reducing levels and preventing further organ damage. Medications called chelating agents help remove excessive copper from the body. Zinc therapy may also be prescribed because it reduces the amount of copper absorbed from the blood. Patients are often advised to follow low copper diet by limiting foods such as shellfish, liver, nuts, and chocolate. In severe cases involving liver failure, a liver transplant may be necessary, according to the National Institute of Diabetes and Digestive and Kidney, 2023. From a Christian perspective, scientific advancements in medicine allow healthcare professionals to diagnose and treat diseases such as Wilson's disease more effectively. Through blood tests, urine tests, genetic testing, and specialized eye exams, physicians can identify the disease before irreversible damage happens. These medical advances can be viewed as ways that humans participate in God's redemptive work by helping alleviate the suffering and restoring health and caring for others. The knowledge and tools provided through scientific research allows healthcare professionals to serve patients with compassion and improve their quality of life. In conclusion, Wilson's disease is a rare genetic disorder that causes toxic copper accumulation throughout the body. It primarily affects the liver and nervous system and eyes, but it also can affect other organs. Although there is no cure, early diagnosis and lifelong treatment can help individuals manage this and live a productive life. Thank you for listening.